Hello everyone, my name is Sina Ali. I am going to talk about the second part of the diagnostic imaging in oral and maxillofacial surgery. Advanced imaging type of advanced imaging الالتراساوند الionizing radiation computed tomography fan beam CT cone beam CT والmagnetic resonance imaging. Advantage of advanced imaging three-dimensional and cross-sectional imaging. Primary diagnosis of the lesion affecting maxillary sinus, facial fracture, base of the skull lesion, and lesion of the soft tissue of the head and neck. Refines differential diagnosis acquired by conventional radiography. Optimize treatment. Optimize treatment planning by displaying full extent of the lesion, permitting more accurate measurement. A disadvantage of advanced imaging is poor spatial resolution in comparison to conventional radiography. Ultrasound. Ultrasound means high frequency sound waves above the limit of human audibility. Procedure of ultrasound. A transducer probe converts electrical energy into high frequency sound waves, which pass into the tissue of different density. The echo of ultrasound are reflected back to the scanning transducer were converted into electrical energy, which are displayed on a monitor as image. Reflection of ultrasound waves by various tissue. Fluid, urine, blood, and cyst. All the waves are allowed to pass without reflection, but bone and hair, lung, reflected back and not allowed passing. Soft tissue, muscle, and fat are partly allowed to pass. Advantage of ultrasound. Outdoor procedure. Portable equipment. Safe, no adverse reaction. Non-invasive, painless, not expensive, easily repeatable. A disadvantage of ultrasound. Since bone and hair and lung completely reflected the ultrasound waves, so any intracranial and intrathoracic lesion cannot be evaluated. The Doppler ultrasound. It is used to detect and measure the rate of movement of any fluid, such as blood. In color Doppler, the direction of flowing blood distinguished by different colors. Applications or uses of ultrasound for reduction of cervical lymphoadenopathy, examination of various muscles, including thyroid gland, abscess, salivary gland, vascular abnormalities, Doppler ultrasound, aid in differentiation of solid or cystic muscles, valuable for guided fine needle aspiration biopsy. Computed tomography. Tomography, tomo mean select, graph mean pictures. Early CT scanners took several minutes to acquire a single select, while a modern scanner can acquire 64, 128, 620 select in 10 to 50 seconds. Scan time by use of advanced powerful computers. Select 0.5 to 3 mm width provide very good detail of the tissue. The standard plan of CT scan is obtained in axial plane. The X-ray attenuation values of CT scan are scored from 1000 to 1000 Hounsfield unit. Type of CT scan. Computed tomography can be divided into two categories based on equation X-ray beam geometry, namely fan beam and cone beam. Spiral CT scan. This type of CT scan obtains a volume of continuous silic 128 to 620 silic as thin as 0.625 mm within second. Spiral CT scan has many advantages over conventional oral axial CT scan. It minimizes motion artifact because the entire scan time can be performed during a single breath hold. Number 2, it reduces the X-ray dose to the patient. Number 3, it improves spatial resolution by giving three-dimensional pictures. A cone beam CT scan applied in density since 1998. Cone beam CT scan has many applications in oral and maxillofacial defect, and it is especially used for preoperative planning for the placement of dental implant. Quality and quantity of measured easily from point to point. Selection the proper length and diameter of the implant can be easily done. CBCT used to access the precise relationship between the impacted tooth and the adjacent structure. Also used for the evaluation of bone density. CBCT has advantage over conventional CT by giving three-dimensional image and exposing the tissue to relatively small doses of radiation. CBCT 3 to 28 OBG radiation dose. Medical CT 33 to 82 OBG radiation dose. Advantage of CT scan: non-invasive, quick imaging, scan time less than 1 minute, so reduced patient motion artifact. Evaluation of bony structure and soft tissue. Contrast resolution of CT is much better than conventional X-ray. Gives three-dimensional image of the body, so it gives the exact size of the lesion and its relation to adjacent normal structure. CT differentiation various body structure from each other and demonstrate their relationship. No superimposition. Use it for post-operative evaluation and follow-up. The disadvantage of CT scan: ionizing radiation, expensive, children require sedation, respiratory motion or body motion lead to degradation of the image. Allergic reaction to contrast medium. Artifact scatter due to presence of dental amalgam filling and metallic crown. Radiation dose of medical CT scan exceeds that of CBCT and conventional panoramic radiograph. Application or uses of CT scan: head and facial skeleton fractures, osteolytic lesion, and hyperkeratosis. Intracranial lesion, hematoma, infection, abscess, tumor. Intraoral mass, paranasal sinus, larynx, nasopharynx, salivary gland. Cervical lymphoadenopathy and neck masses. Effective means of guiding the placement of the fine needle for biopsy. Angiography using contrast agent. Magnetic resonance imaging. Magnetic resonance imaging can be used to distinguish oxygenated blood from deoxygenated blood and named as functional magnetic resonance imaging and published the first functional image using bulk signal with T2 in 1992. The principle of the RI is based on the magnetic properties of the hydrogen proton body tissue that contain hydrogen atom. In magnetic resonance imaging examination, a patient is placed in a powerful magnetic field in which the proton within the body become elegant longitudinally when increasing the radio wave, a radio frequency. Thank you for listening.